Right, well, we all have it. Whether you're a man or a woman, you've got estrogen in your body. But there are some positive and negative effects of that hormone. And Dr. Rob is here. He's in the house today to tell us what those are and how to balance everything out. D-Rob.
Balance is a good thing in all things in life, and especially hormones.
Yes, about hormones. I'm sure that was news to a lot of folks that both men and women have estrogen.
Yes. Both men and women have estrogen. It plays a very important role in our health, in particular cardiovascular health, bone health, brain health, and there are estrogen receptors all over your body in all kinds of tissue that respond to the effects of estrogen, both positive and negative. All
right, let's talk about the good stuff first.
Yeah, absolutely. Let's talk about the good stuff. And we have a graphic that Dominica is going to bring up for us.
There we go.
And this shows, I know it's a really complicated graph, but what we're looking at is at the family of estrogens. And across the top we have estrone, estradiol, and estriol. Three of the estrogens that make up this family. And they all get metabolized into estrogen metabolites.
Okay.
Two of which are bad. On the right there, we have one that's called 16-hydroxyestrone, another one called 4-hydroxyestrone. Those are the bad ones. 4-hydroxyestrone is actually genotoxic. It changes the genetic makeup of your cell and causes cancer. And that is not one that you want your body making.
You don't want that.
16-hydroxyestrone is also, it's not as bad as 4, but it also, you don't want a lot of it because it takes the alpha and beta receptors in the tissues of the cell, like the cervix, the uterus, the ovaries, the prostate, the breast, and it can make gene expression come out and change the cellular structure, which leads to cancer.
Okay, so 4 and 16 are bad. Those are the ones we don't want. Number 2, though,
Number
is
2,
good.
2-hydroxyestrone is the one we want our body to make. It's balancing, it's beneficial, it makes us feel good, it's good for our brain, it's good for our heart, it's good for our bones, it's good for sex.
Pause.
You gotta have the 2-hydroxyestrone. Right. So that's what you want your body to make. Now, how do you know which estrogen your body's making?
Right, that's a big question.
That first graphic was actually a hormone metabolite test. And that's one of the things that you should have your doctor do is, hey, I'd like to see what my hormone metabolites are. And you get this test, and you can know what kind of estrogen your body's making. Is it making the 4? Is it making the 16? The 2 that are bad that we don't want? Or is it making the 2, which is the good one?
Right.
So get your hormone metabolite test.
But how does that manifest itself physically? Is there a telltale sign that we know, whether you're a man or a woman, that you have some type of hormonal or testosterone imbalance?
Yes, there is a way that we can tell for women, depending on where they're at with their age and their cycle. You could have estrogen excess, which can lead to weight gain and moodiness and irregular periods. And for men, it can lead to weight gain and moodiness as well, and decrease of libido if they have too much estrogen. So it does affect men and women in different ways. Now, there's ways that we can correct that. One of the biggest things that you can do is stop smoking. Smoking kills.
A no-no.
It's terrible for your entire body, so stop smoking. Now, what we can do is exercise. Exercise helps clear out the metabolites. It's a way to detoxify the body. But guess what? There's great vegetables that you can eat on a regular basis that help benefit your body in taking estrogen metabolism down the 2-hydroxyestrone, the healthy estrogen. That's the cruciferous vegetables, cauliflower, broccoli, Brussels sprouts, and the superfood that hides in your grocery store that not too many people know about.
What's that?
Broccoli sprouts.
I haven't seen those in a while.
Yeah, those are super healthy food that helps you metabolize estrogen down the right pathway, so you make the balancing, beneficial kinds of estrogen.
Right, and with a couple seconds left, of course, if you can't get it in your diet, there are some great supplements that you can go to as well. And Dr. Rob there at the Alpha Male Institute, you do that test as well, right?
Oh yeah, absolutely.
And quickly,
men and women.
A book that you have just released. It's called Low T.
Yep, our new book just released yesterday called The Low T Book. You can find it at thelowtbook.com. And sales are very brisk. We sold on several different continents already just in the first 24 hours. So,
well, it's all about the hormones and the estrogen and testosterone. Dr. Rob has it mastered. Thanks, Dr. Rob, and good luck with the book.